There's basically three main options when it comes to hormone replacement therapy. One is the synthetic pathway, which the majority of women in this country are on if they choose to do hormones, and those are the FDA-approved medications that can be taken in the oral form through patches, sprays, gels that insurance usually does cover to provide hormone replacement therapy. The second option is to do bioidentical hormones, which are the hormones that are made from plants that mirror what our body makes naturally, and that is prescribed based on specific lab values for each patient. And then the third option is to do pellets, which are little rice-sized pellets that are placed in a woman's hip to provide estrogen and testosterone, and those are also bioidentical. So there's three main options that women can choose, and what I wanted to do here in my practice is offer all three options so that a woman could come here and have everything in one place. If she tries the creams, for instance, and after a few months doesn't want to keep doing that, she can pull back and decide to go down either the synthetic road option or the pellet option, and she has everything in one place. She doesn't have to hop from building to building or hop from doctor to doctor. There's one physician that has all of her medical records, all of her history, and all in one location. And that's why I wanted to have everything here for patients.
The pellet form of Dr. Brady's hormone replacement options, called BioT, has gained a lot of support from her patients, both female and male.
My wife needed some therapy, and then she suggested I take a look at it. And when that took place, when I was able to get BioT therapy, I noticed a total change in my physique, my wellness, my attitude, really, I was less irritable.
It's easy. It is a bioidentical pellet about the size of a little grain of rice, and they are testosterone and estrogen pellets. They are bioidentical, so they're made from plants and match what our body produces naturally, and they're placed in the hip. They last anywhere from 3 to 6 months, depending on how active a patient is. They dissolve according to cardiac output, so patients who exercise daily and are very active will go through them quicker than a patient who sits on the couch all the time.
I felt within a week a little clarity of mind, and I run $1 million business, and so I noticed that right away, that working with numbers was easier all of a sudden. Remembering things were easy. And then about the second week, I started noticing I'm sleeping better, and then the third week I noticed, gee, I think I may want to go for a walk.
A typical patient has been out of balance for months to years, and in order to balance her hormones again, it's not an overnight fix. She's got, basically, there's three main compartments. There's estrogen, testosterone, and thyroid, and we have to balance each compartment with each other. So I tell patients from the get-go, expect a minimum of 3 to 6 months to knock this out, and then once we get her stable on her regimen, whatever's going to work for her, and it's different for every patient, then we just keep her there.